Got it. I'll give you a fully detailed and structured drug profile for sitagliptin, as you'd need for exams or clinical reference. Sitagliptin Complete Drug Profile. Number 1. Generic name, drug class, brand name. Generic name sitagliptin, drug class, antidiabetic drug, dipeptidyl peptidase 4, DPP4 inhibitor, oral hypoglycemic agent. Brand names, Januvia monotherapy, Janumet, sitaglip plus metformin, Juvasync, sitagliptin, simvastatin, some markets. 2. Definition. Sitagliptin is an oral antidiabetic agent that improves blood sugar control in adults with type 2 diabetes mellitus, T2DM. It belongs to the class of DPP4 inhibitors, which act by enhancing incretin hormone activity. Sitagliptin lowers fasting and postprandial glucose without causing significant hypoglycemia or weight gain. 3. Mechanism of action, MOA. Normally, incretin hormones, GLP-1, glucagon-like peptide 1, and GIP, glucose-dependent insulinotropic peptide, increase insulin release and decrease glucagon secretion after meals. These hormones are rapidly degraded by the enzyme DPP4. Sitagliptin inhibits DPP4, leading to 1. GLP-1 and GIP levels, 2. Insulin secretion, glucose-dependent, 3. Glucagon secretion, 4. Hepatic glucose production. Net effect, improved glycemic control with minimal hypoglycemia risk. 4. Uses. Management of type 2 diabetes mellitus, T2DM in adults. Used as monotherapy when diet plus exercise alone are inadequate. As combination therapy with metformin, sulfonylureas, thiazolidindiones, pioglitazone, insulin, SGLT2 inhibitors, dapagliflozin, and pagliflozin. Number 5. Indications approved for glycemic control improvement in adults with T2DM. Indicated when patients fail to achieve control with lifestyle modifications alone. Patients require additional therapy to existing antidiabetic drugs. Not indicated for type 1 diabetes mellitus, diabetic ketoacidosis, DKA, severe hyperglycemia requiring immediate insulin. 6. Contraindications. Hypersensitivity to sitagliptin or any component of the formulation. History of serious hypersensitivity reactions, e.g. anaphylaxis, angioedema, Stevens-Johnson syndrome, type 1 diabetes mellitus, diabetic ketoacidosis, severe renal impairment without proper dose adjustment. Number 7. Before taking this medicine, precautions. Kidney problems. Sitagliptin is primarily excreted unchanged in urine, dose adjustment required. History of pancreatitis. DPP4 inhibitors have been linked with pancreatitis. Heart failure. Some DPP4 inhibitors, saxagliptin, allagliptin, increase risk. Caution with sitagliptin. Hypoglycemia risk, higher if used with insulin or sulfonylureas. Pregnancy, limited data. Use only if benefits outweigh risks. Breastfeeding, not recommended. Drug excreted in animal milk. Alcohol intake may worsen glycemic control and increase risk of hypoglycemia when combined with other antidiabetic drugs. How to use. Take orally, once daily, with or without food. Swallow whole with water. Should be taken at the same time every day for consistent effect. 9. Dosing information. Adults with normal renal function, 100 milligrams once daily. Renal impairment adjustment. eGFR 45 min 1.73 milliquadrad, 100 milligrams once daily. eGFR 30 to 44 milliliters per 3 millispreads, 50 milligrams once daily. eGFR 30 milliliters per min 1.73 milliquadrad, or on dialysis, 25 milligrams once daily. Hepatic impairment, no dose adjustment usually required. Elderly, adjust dose based on renal function. Number 10. Missed dose, overdose. Missed dose, take as soon as remembered. If close to next scheduled dose, skip. Do not double dose. Overdose. Symptoms, hypoglycemia, SB with sulfonylurea insulin, GI upset. Management, supportive care, glucose monitoring, IV glucose if hypoglycemia occurs. Dialysis. Sitagliptin is dialyzable, 13.5% removed in 3 to 4 hour session. Number 11. Stop or avoid taking. If severe allergic reaction occurs, rash, swelling, difficulty breathing, if pancreatitis symptoms appear, persistent, severe abdominal pain radiating to back with or without vomiting, if severe joint pain develops, reported with DPP4 inhibitors, if bullous pemphigoid, rare blistering skin reaction occurs. 12. Side effects. Common, mild, nasopharyngitis, cold-like symptoms, headache, upper respiratory tract infections, diarrhea. Less common, moderate, hypoglycemia, more when combined with sulfonylurea insulin, GI upset, abdominal pain, nausea, serious, rare but important. Pancreatitis, severe abdominal pain, vomiting. Severe allergic reactions, anaphylaxis, angioedema, Stevens-Johnson syndrome, severe joint pain, arthralgia, bullous pemphigoid, autoimmune skin blistering disorder, renal impairment, worsening kidney function in predisposed patients. Number 13, vital information. Key points for exams and practice. Sitagliptin is weight neutral, unlike sulfonylureas and insulin. Low risk of hypoglycemia unless combined with insulin or sulfonylureas. Requires renal dose adjustment. Monitor blood glucose, HbA1c, kidney function, and pancreatitis symptoms. Usually well tolerated with mild side effects. Can be safely combined with metformin, insulin, or SGLT2 inhibitors. Number 14, other drugs that will affect sitagliptin. Increased risk of hypoglycemia when combined with insulin, sulfonylureas, glimepiride, glipizide, glyburide. Drug interactions. Digoxin, sitagliptin may increase digoxin levels, monitor digoxin toxicity. CYP3A4 and P-glycoprotein inducers inhibitors, rifampin, ketoconazole, cyclosporine, may alter sitagliptin plasma concentration, usually minor. Alcohol increases risk of hypoglycemia and worsens glycemic control. Thank you. Have a nice day.